Hello, my name is Representative Pam Powers Hanley, and I represent LD9 in Tucson in the Arizona House. Today is March 22, 2022. This is the last week for bills to be heard in committee in the Arizona legislature. Yesterday was the last committee meeting for Health and Human Services. There were a few bills that were somewhat controversial and, in my opinion, didn't go far enough. We talked a lot about homelessness, we talked about drug addiction, we talked about mental illness and how this all relates to the homeless population in the state of Arizona and to affordable housing. One thing that was left out of the conversation, except for me mentioning it at some point, is that all of these issues are related to stingy policies from the state of Arizona, and we have created the problem that we have with homelessness and affordable housing in the state because we fail to recognize and fail to tackle poverty. We have chronic poverty in this state, and our policies perpetuate chronic poverty. And that's why we have a homelessness problem. And so there were a couple bills on the agenda yesterday that specifically dealt with homelessness. And so the first one, which was the most controversial one, was SB 1581. This was Housing Grants Homeless Camping Appropriations from Senator Livingston. It's a strike everything bill. There's lots of strike everything bills right now. And so what this does is it takes $50 million in federal funds and sets up a grant program so cities and towns can apply to have a grant in order to build sanctioned camping areas for homeless people. And this would include showers and bathrooms and a laundry facility. It would include referrals to wraparound services and things like that. This is actually something that I have supported for a while. Back in the day when we had the dreampods and the tents set up on 20 Agosto Park right outside the county buildings, one of the things that the homeless people were talking about was sanctioned camping area. If the city didn't want them in the park, give them a place where they're allowed to set up their tents. And so that's what this bill does, but I ended up voting against it because it has some civil liberties issues. For example, this bill says that any city or town who takes the money from this grant program has to fully enforce their street sleeping bans. And so this has actually been the subject of a court case in the Ninth Circuit Court, and they said that cities can't enforce these no sleeping on the street bans when they don't have any indoor beds for the homeless. So there's a little bit of a legal wrinkle to this. And so this says that a team of a counselor, some sort of a social worker, and potentially a policeman coming around, finding homeless people and saying, hey, why don't you move yourself over to this sanctioned camping area? And if they refuse, they could be arrested. We don't want to criminalize being homeless. We don't want sweeping the homeless people and shoving them into some sort of a cordoned off area just so they won't be an eyesore in front of somebody's business, which is primarily what we heard about. Oh, homeless people on the street, it's bad for business. Well, it's bad for them and their families also. And so I voted against it because they need to take care of the civil liberties issues about this bill. So I'm a no until they fix it. Another one that we had was SB 1263. This is Lottery Fund Shelter Services, another strike everything. This takes $3 million from the lottery money and puts it into shelter services. Sounds like a good idea. The problem is that there are so many people living on the street that this is just a drop in the bucket. So I voted for it, but still it's not enough money. Another one that we had was SB 1467. This is Access Drug Treatment Testing Reporting. Apparently, the state of Arizona is spending $8.9 million in Medicaid funds on drug treatment, and they don't really have any evaluation. The only reports that have looked at cost, not effectiveness. You need to look at effectiveness. And so what this does is that it sets up the Recovery, Support, and Accountability Program in the Arizona Healthcare Cost Containment System. And so the problem with this, because my area was addiction when I was at the University of Arizona, and it takes a long time for people to quit drugs, even drugs like nicotine. It can take 7 attempts to quit smoking cigarettes. And so each one of those attempts is a learning experience. What this bill does is that it focuses on hounding people after treatment for drug testing. And so drug testing and the threat of drug testing is not going to keep them quit from drugs. It's going to stress them out. And so every relapse is a learning period, and we should get them back into counseling or back into treatment rather than trying to hound them about drug tests. And so this bill is a bad idea. It's also not well thought out. They don't have any experience in research. I asked them, questions about a quit rate and how they would calculate it across all these disparate services, and they're like, ugh. They didn't know. They don't have a clue. This bill is needed. We should be evaluating our drug treatment services that we're paying for, but this bill is not ready for prime time, and I voted against it because it's just hounding patients. So you can see how we're nipping around the edges of homelessness and poverty and drug addiction and mental illness, but we'd have no comprehensive plans on this. It's all one-off bills and strike everything bills that popped out of somebody's head or it was brought to them by a lobbyist. And so we need to fix these programs, but we need a comprehensive look at it. And we also have to address poverty. We're not addressing poverty. We're only addressing the result of poverty, not the root causes.